All right, so for week 2, the first article, How Advertising Practitioners View Ethics, I chose the question, what rationalizations support moral myopia and muteness in real organizational situations? So, moral myopia is failing to see ethical concerns, while moral muteness is seeing those ethical concerns but staying silent. Some rationalizations for moral myopia that the article mentions are that consumers are smart. They are assuming that the audience can see through any misleading claims. Or that if it's legal, it's moral, which is ignoring deeper ethical concerns. They're practically saying that if no laws are broken, then it shouldn't be deemed as unethical. And some argue that they argue the First Amendment. We can't limit free speech. It's treating any ethical critique as a type of censorship. And others are just too close to the client to notice the problems. They are practicing the ostrich syndrome, which is basically just putting their head in the sand and ignoring issues altogether. For moral muteness, some of the rationalizations mentioned were that the client is always right. If you question your client, that can be bad for business, so it's best to just not speak up or ignore any moral concerns that you might have. Also, people view ethics as bad for business. If you voice ethical concerns, you might be seen as naive, so instead, people just choose silence. And lastly, there's the Pandora's box worry that many ethical issues are avoided because it's thought that once we start questioning, everything becomes a problem. These rationalizations help make unethical decisions go unnoticed or unchecked. So for the second part of the week, we watched the TED Talk, Would You Lie by Sarah Strode. I chose to answer the question, when making tough choices, do consequences, intentions, or duties weigh most heavily for you and why? So I think a lot in my life, for a lot of my life, I used to mainly be guided by consequences, whether I would get in trouble, get caught, or just be benefited in some type of way by a situation. But in the past couple of years recently, I kind of just shifted my perspectives, my mindset, and I really believe that when I make tough choices, I now feel that intentions and duties weigh most heavily or are starting to weigh most heavily on me. I care about who I'm presenting myself as, but also who I fully am on the inside and who the true me is. I want to make sure that my actions overall align with my goals and my values. So I started thinking about my job as a medical assistant, and there are many times where I can cut corners, I can try to save time, and there'll be no actual bad outcome. There won't be any harm done. It's just not the procedures and how we do it. But I also know at the end of the day, it's my duty to follow our procedures, to follow the protocols we have in place. It not only protects me and my role, but it also protects the trust that the patients are putting in our organization. They are coming here to trust us and know that we're doing everything properly and as we should. That being said, I definitely still think a lot about consequences of my actions and how they do affect me and others. I just overall don't think it's my main concern anymore, and I truly do care about the intentions behind what I'm doing and what my actual duty is in making my decisions. Thank you.